Hello and welcome, my name is Chris from christopherhole.com. Welcome to this video where we're going to be talking about IT band syndrome. First of all, we're going to look at what it is, then we'll look at some anatomy, some causes, and some potential treatments. What I don't want this video to be is a diagnosis of a problem or possibly you self-diagnosing. That's not its intention. Its intention is to educate about what things are, causes, some anatomy, and some potential lines of treatment. So the main thing on your part is making sure that IT band syndrome is what you're suffering with, and then it will give you a bit more in the way of education as to go about treating and rehabilitating that. So, IT band syndrome is the inflammation of the IT band as it moves over the lateral femoral condyle. So some quick anatomy of what all of that means. So normal area of pain around the insertion of the iliotibial band. So the IT band is the iliotibial band, and it's this big white sort of material or tissue that goes all the way up the leg. It joins the glutes and the tensor fascial artery at the front all the way down and joins onto the knee. Now, as you heard, as it moves over the lateral femoral condyle. Now that is basically a bony landmark where the iliotibial band inserts. So it's just sort of flicking over, and then that creates an inflammation. If you've got a pain sort of up here, or you've been told you have a tight IT band, generally it's the vastus lateralis that's just very tender, if you will. And that just needs a bit of foam rolling to work itself out. That's what I find generally. But we've got potential causes are overuse, so sort of like a repetitive type of strain. You've got overpronation, so that's your feet collapsing in, pulling your knee in with it, and then causing the IT band to move in a position that it doesn't necessarily want to move. Tight lateral tissues, the TFL and glute. So that's the muscles that join in at the top, so the glute max and the TFL on the front. So it can be loosening those off releases the pressure downstream, if you will. Then you've got leg length discrepancy and poor biomechanics, which will have a little bit to do with overpronation and possibly the tracking of the knee when you run, when you walk, when you squat, when you lunge, so on and so forth. So some potential treatments. First of all, correct the underlying cause, which would be potentially one of these. Then we're looking at stretching, foam rolling, and massage. Now, things like foam rolling and massage could be quite painful to begin with. But as I've mentioned, generally it's a tight lateral quad that needs work, and not necessarily the IT band. So it's very much making sure that you're treating the right tissue for the right condition, if you will. So that's the IT band syndrome. Just a quick overview. It's inflammation of the IT band as it moves over the lateral femoral condyle, which is the bony landmark down on the knee. You've got some potential causes, which is overuse, overpronation, tight lateral tissues, leg length discrepancy, and poor biomechanics. And then treatment, correct the underlying cause, which is one of these, stretch, foam roll, and massage. So hopefully that's been useful. Hopefully you've gained some more insight about your condition, and hopefully you've gained a little bit more insight on some potential treatments that you can go through. So many thanks for watching. My name is Chris from christopherhole.com. I'll speak to you in a future video.